Namaste and welcome to the next episode of Clinical Ayurved. We were discussing clinical aspect of rasas and we were discussing tittaras in that regards. In last episode, I have asked you one question. Katuras and tittaras both have ruchikara karma. Then what is the difference or what is the exact indication of these two rasa performing the same function of ruchikara? In Dipan and Pachan Karma, we have discussed in detail about Tikta Rasa. Tikta Rasa is a Shrestha Amapachak Rasa, and hence, when there is Sama Jivva or tongue is coated because of Amapatti in the body, and that's why Aruchi is the complaint of the patient. In that case, for Amapachan, Tiktaras is indicated. We have seen in last episode, Tiktaras Swayam Arachishnu. It is not good for the taste itself. Still, it is performing Ruchikara Karma only when there is coated tongue because of Amodpatti. And when there is no coating of the arm or there is no amapatti but still there is loss of taste, in that condition katuras is indicated. Udvejati jivagaram, we have seen the symptom of katuras. It stimulates the taste buds of the tongue and makes perform the ruchikara action in that manner. So tiktam swayam aruchir, still it is ruchikara only when there is samata, it is ampachak, and when it is ampachak is done in the body, then the coating of the tongue is automatically cleared off and ruchikarma is established. So this is the difference between the ruchikara karma of tiktarasa and ruchikara karma of katurasa. The next line of Ashtarudaya describing Tiktarasa functions is Kushtamurcha Jorot Klesha Daha Pitta Kapanjay. Now, Kushtha, in the what actually happens in the Kushtha, it is a skin manifestation is there. There are so many of varieties of Shudra Kushtha, Mahakushtha. I will not go in detail at present in that, but the basic phenomenon of in the Samprapti which happens in the Kushtha is increase of Raktagata kleda, and this increased kled in the Rakta Dhatu disturbs the Varnya karma of Rakta and the skin lesions are formed. Tiktaras is of Ruksha Guna, Shoshane Ruksha. All the Gunadharma of Tiktarasa are against Kapha and kleda, and hence it is useful in Kushtha by reducing the Raktagata kleda. Now, always remember that, I will come to that point in next description. So, Raktagata kleda, Tiktarasa by reducing the kleda in Raktadhatu. Kushtha Murcha, Jwarat Klesha Daha Pitta Kapanjay. Murcha I will discuss this function when we are describing about Tiktarasa, Midya Karma of Tiktarasa. Okay, so let us keep aside because it has got a separate discussion to be carried out. Jwarat Klesha. Now Jwara, we know Jwara is Amapradhan, Agimande, Amapatti, and we are discussing Dipan Pachan in detail. So it is Jwaragna by first way Ampachan Karma. Secondly, Jwara is the disease of Pitta dosh. It is Tiktaras is altogether Pitta Shamak. It is why it is Tikta Madhur, both are Pitta Shamak. But what is the specific quality of Tiktaras is Pitta dosh Pradhan Vyadhi are of two types, Sama and Niram. And Tiktaras is useful in both these conditions. It is Ampachak because of its properties as well as it is Niram Pitta Shama. See, Madhuras is also Pitta Shama, but it is contraindicated in Sama Pitta Vyadhi. So, Tiktharas is more, it has got more importance in that regards because it has got action on both conditions of Pitta Vyadi or Pitta Dosh, Sama Pitta or Nira Pitta. Even Kasharis is Pitta Shama, but it is not again indicated in Sama because it is heavy for digest. So, in my opinion, for Pitta Vyadi, if you compare Madhu Pitta Kashaya, Tiktharas will be have more important than other two rasa. So, Jwara, Ampachak, Jwara, Pitta Shamuk, and Tiktharas is useful. Utklesha, Kushta Jwara, Klesha. Utklesha means vomiting sensation. Now, how you will use this Tiktharasa? We can use Tiktharasa in Utklesha by two ways. First, Utklesha is vomiting sensation. Patient always complains that something is coming out, and if it gets vomited, I will be relieved. Tiktharasa itself is aruchikara, so it can induce that vomiting action by its taste. So, first line of action in Utlesh is sort of Shodhan action by inducing woman by its aruchi. Of course, and second action that patient sometimes patient says, okay, vomiting I can't sustain because I am very fear about that vomiting, so I don't want that line of action. So you have to absorb that vomiting content which is trying to come out. In that case, it is of Jala Guna or Jala Mahapradhan, Drava Guna. So Shoshanya Rukshaha, Tiktharas can be used in that way for as a Shaman Chikitsa. It will go inside, it will absorb all that Drava content and Utklesh will be relieved. Now, how you will decide to choose Vaman Chikitsa, Utklesh or Shaman Chikitsa? It will depend first on Vyadhi Bala, Rugna Bala and Rugna Sattva. If he is really can sustain that Vamana. Secondly, Vaya, Bal Garbhini, as you know, it is contraindicated, Vruddha, it is contraindicated. So, you can assess the patient, Sushma Samikshesha, and then you can decide whether to go for Shodhan Chikitsa in Utlesh by Tiktharasa and Shaman Chikitsa by Tiktharasa. See, I have seen the patient when there is vomiting sensation, just a small amount of Sudarshan or Kadachara is enough to get it vomited. It is so of Tiktharasa, it is of great Tiktharasa Dravya, and that intensity of Tiktharasa is enough to get the Shodhan Chikitsa. Now, what precaution you should take when you are using Tiktharasa as a Shaman Chikitsa in Utklesha? In that case, it is aruchikara. We are using Tiktharasa as a Shodhan by implementing it on the tongue, and that bitter taste induces vamana. Now we are using it for Shaman Chikitsa, so you should avoid that Tiktharasa contact with the tongue, otherwise it will produce vaman. So in that case, avoid powder to be given, make the tablet which are easy to swallow, or more better choice, give that Tiktharasa Dravya in the capsule form, so the tablet may patient find a bitter taste, but in capsule it will go directly in the stomach without any interaction with the taste buds on the tongue. So in Shodhan you can use it directly, apply on the tongue, make it vomited. In Shaman, give in a way that it should not be in touch with the taste buds, and that bitter taste will not come in contact or in the sense or as a sense organ of the tongue. So this is about Tiktharasa today. About few karma, we will discuss this karma Tiktharasa in next episode also. Thank you very much.